Hi, I'm back with this presentation on artificial intelligence as I promised to some of the delegates. So let's see how artificial intelligence works. So it basically uses some technologies called machine learning and large learning models, where it uses information from massive data sets which contains text from various sources such as books, articles, websites, and so on and so forth. And it uses technologies like deep learning and natural language processing to basically develop advanced algorithms to understand like a human brain and provide you with information which is very quick and fast. Now let's see certain applications of AI. Most important is diagnostics and predictive analytics, which is already available now. So AI devices for detecting skin conditions like melanomas, and also predicting analytics for surgical outcomes like hair studio for predicting the outcome after certain number of hair densities and certain pattern. And also for personalized treatment planning like the simulation tools you have come across for nose or rhinoplasty and breast surgery. And then for AI, for image analysis and augmented reality. And the classical example is the Artus robot, which is the robot for hair transplantation, but also the Da Vinci robot that is being used now to harvest flap, particularly for breast reconstruction like the LD flap. So it is used as a surgical assistance also. And for telemedicine, it is for plastic surgery consultations. It also has applications in regenerative medicine where they are studying stem cell behavior by using AI, and also it is used for tissue engineering and scar minimization. So that is still in work on progress. Yet another application is workflow management. So it is used to automate the administrative tasks and also as AI chatbots for preoperative and postoperative care to the patients. A huge advancement is in education and training where it is used as a self-learning device. And then for patient outcome prediction and monitoring, there are some tools which are used for postoperative monitoring, for example, flap monitoring and predicting complications. And then finally for research and development. So to summarize, for plastic surgeons, we have it for preoperative planning. It will help simulate outcomes like you've seen. For surgical precision, like the robotic systems for complex procedures like hair transplant and reconstructive surgery. For post-operative care to monitor recovery and predict complications. And for dermatologists to diagnose skin conditions in certain innovative treatments for rejuvenation, teledermatology. But there are challenges and there are three big concerns. One is ethical concerns. We don't know how AI will start controlling these data. And AI hallucination, which is very interesting. And of course, the cost involved in the beginning and ongoing. So what is AI hallucination? Basically, it is a phenomenon where AI model generates inaccurate, irrelevant, and fabricated information. For example, ChatGPT is such a tool which collects information for whatever is available in the Google, including personal blogs, personal opinions, and individual websites. So the key characteristic of AI hallucination is it gives confident misstatements. The AI provides false information with a tone of confidence, making it harder for users to identify inaccuracies. Fabrication, in some cases, AI invents details, relevance but inaccurate details. So how to mitigate AI hallucination? Verification, cross-checking of the AI outputs against reliable sources, which is practically very, very difficult for us like professionals and doctors. And human oversight is required to ensure that a knowledgeable person reviews critical AI generated content. And of course, improve training of the tool. The AI needs to be trained to be able to collect information from reliable sources and to provide in an accurate and a systemic manner. So here are some of the tools available globally. One is the certified AI plastic surgery professional tool called Tonex, which is basically for certification course that equips a surgeon with AI integration skills in plastic surgery. Then there are dermatology tools, AI tools. Then there are AI powered diagnostic platform, and Google uses one of them called Google's AI dermatology tool. Then there is virtual reality training simulation tools available. In India, orthopedics have developed a tool called as Ortho AI, which has become very popular, and it's like a co-pilot to the orthopedic surgeons. In US, in South America, Dr. Alfredo Hoyos has developed LISA, which is Liposuction Intelligent Safety Assistant. And finally, I have worked to develop this system called Dermaplastic.ai. That is me. Thank you very much. But what is LISA? LISA basically is only for liposuction of body contouring, where once you subscribe to that, you can enter all your patient data that is required for preoperatively, and it will give you a correct information on how much fluid to use, what is safe, what is dangerous, what are the DVT prophylaxis that you need to use. Even it gives you anesthesia parameters that needs to be used during the procedure. Now, most important, this is my favorite because I have involved myself in this one, developed it for a few years now. It is basically a tool that will be for professionals, mostly for dermatologists and plastic surgeon, that will provide them correct information which is evidence based and in a correct format that will help us easily understand and reproduce this and use it for our purposes. It is not only for the doctors, surgeons who are already practicing, but also for youngsters, for quick answers, for treatment plans, for pre and post-operative protocols, medical report, how to create a medical report, even answer short notes and essays, prepare presentations for lectures, write short books. For patients, it's very useful tool as well. It is in a different language for them, which makes it easy for them to understand, not like for the doctors, which is more technical language. So they can ask any questions about the surgeries, the preoperative care that they need to do, post-operative care. So in my practice, I just ask them to download this and ask any question that they would want me to answer physically. So it is for both medical and non-medical staff as well. For training purpose, all my nurses, my technicians, they learn from this technology. My call center uses this to basically train their receptionist and call center staff. So I've got some very good feedback from many doctors. And obviously the question I've been asked is, what is the difference? How it is different from ChatGPT? There are some of these differences. One is, of course, I am vetting it. I'm a qualified plastic surgeon with years of experience and huge knowledge, and I'm well read. So I have collected a lot of informations. I have used PubMed and open source journals, but I'm also buying copyrighted from medical journals. That's why in future there may be some subscription fee as well. I'm going to keep it updated on a regular basis. This is my now my lifetime project. So it will be on a regular update as compared to ChatGPT. And it is compliant with HIPAA. Also, it will eventually be able to generate images for you, or it will have a set of images, and I have my dreams of providing you a lot more, but let's see how far it takes me, and let's see how you like it. So do scan this, and if you don't like any answer, do write the reason why you don't like and what should be the correct answer, because that is the way of training the AI. Thank you very much. I hope you will enjoy this. Thank you.